Joining me from Raleigh, North Carolina is Dr. Krishna Udayakumar, the director of the Duke Global Health Innovation Center. Dr. Udayakumar, let me begin with what we're seeing in Europe. What is going on? Soaring infections. The WHO has warned the continent could see another 500,000 deaths by February. What happened?
That's right. We've seen for the last almost 2 years that the COVID pandemic has really come in waves. It ebbs and flows. And what we're starting to see is that next terrible wave in Europe, unfortunately. What's driving that? Partially, it's that vaccination rates have really stalled, and they're quite variable across the continents. You've got some countries like Portugal and Spain with very high levels of vaccination, and many countries, especially in Eastern Europe, that are quite low in terms of their overall vaccination rates. We're also going into winter in the Northern Hemisphere with more indoor activities. We're seeing a loosening of some public health tools such as distancing and mask wearing. And we're also seeing a loosening up of some travel restrictions. So all of that really is creating a convergence that's quite concerning.
What is going on in Russia? They too are seeing soaring hospitalizations, record deaths.
That's right. If you look at Russia, the official death toll from COVID is about 250,000 people, but the modeling of excess deaths puts it closer to 720,000. So the burden there has been quite significant. And in addition to all of the things I just talked about, in Russia, we're also seeing a pretty high level of vaccine hesitancy. So in Russia, only 34% of the population is fully vaccinated, and less than 40% of the less than 40% of the total population has even one dose of vaccine. So we're really seeing what's setting up to be another terrible toll there.
Is it safe to say vaccines are a game changer, but simply not enough, doctor?
Vaccines very much are a game changer for COVID-19, but we should recognize that they're only one part of a broader public health strategy, which is why some of these new emerging oral antiviral therapies are so promising as well. If we can layer higher levels of vaccinations with therapies, with better testing and diagnostics, with better public health measures, we're going to have to continue to see all of the above in order to turn the corner on the acute phase of this pandemic.
So what do you make of Merck's antiviral COVID-19 pill? The U.S. has announced, or actually Merck has announced the U.S. is going to purchase an additional 1.4 million courses of that medicine. How does it work? Who's eligible to take it? And when will it be available?
Yeah, both the Merck antiviral that's oral as well as the Pfizer antiviral that's also oral have shown promising results in late phase clinical trials. They're still not authorized in the U.S. The Merck drug was authorized for emergency use in the U.K. in the past few days. What we need to make sure, though, is that we avoid the same challenges as we ran into with vaccines, which is inequitable access around the world. So we need to make sure that with the therapies, at least, that we're creating ways to manufacture around the world, ramping up the scale of manufacturing as quickly as possible, and ensuring that everybody, whether they live in a rich country or a low and middle income country, can get access as soon as possible. And if we do that, we can save lives while we're ramping up vaccinations.
Dr. Udayakumar, I finally have to ask you about Singapore, which says it will no longer cover medical costs for those who are eligible to get vaccinated but choose not to. Is this a good idea?
Yeah, I think what we're seeing in Singapore is the escalation of a lot of incentives that have been in place. We see similar models in terms of mandates from different countries for different populations. So we do need to get to very high rates. And what Singapore is showing us is that even very high rates of vaccinations doesn't isolate that country from the vulnerabilities of more COVID infections. So trying to get as close to 100% of the population covered as possible is going to be important. And we're also seeing, not just in Singapore, but around the world, that even with vaccines, we have a waning of immunity over time. So we're going to be in this game for years to come with boosters and variants. So we need to make sure that we don't lose the energy that's going to be required to continue down this road.
Understood, but you didn't really answer my question if that was the right strategy Singapore is implementing. Good or no?
I think it's a process that needs to play out in Singapore. I have a high level of respect. We have a medical school campus in Singapore. We work closely with the government there. And just like every other government, they need to understand and take the policies that they think are correct.
All right, good diplomatic answer there. Thank you, Dr. Krishna Udayakumar. Appreciate it.